Now let's start abdominal ultrasound screening. First, put plenty of gel on top. Make sure the movement of the probe matches the orientation of the screen. Let's start with the left intercostal space. You see the spleen here. Since the spleen is a retroperitoneal organ, the probe is moved dorsally for observation. The splenic hilum, pancreatic tail, and splenic vein can be observed. Next, lower the intercostal space from there and observe the left kidney. Observe the short axis and long axis. Move the probe to the midline of the body and observe the longitudinal epigastric scan. The left lobe of the liver and the abdominal aorta are visible here. You can also observe the celiac artery and the superior mesenteric artery branching off from the abdominal aorta. The inferior vena cava can be observed by translating the probe to the patient's right side. Now let's check whether the diameter of the inferior vena cava changes with respiration. Then look at the pancreas. Rotate the probe 90 to 100 degrees counterclockwise where the abdominal aorta can be seen, and move it slightly towards patient's foot side to reveal the pancreas. Observe the head, body, and tail of the pancreas. When observing the head, move the probe from the patient's head side to the foot side to observe the hull. While observing the body, check carefully for dilation of the pancreatic duct. Move the probe further to the patient's left side to also observe the pancreatic tail. The spleen, which was observed from the left intercostal space earlier, can also be seen behind the pancreatic tail. After observing the pancreas, we move on to observing the liver. From where the pancreas is visible, move the probe towards the patient's head. Then you can see the left lobe of the liver. Next, the umbilical part of the left branch of the portal vein comes out. Observe the left lobe of the liver carefully. If you can observe it, we will look at the vein next. You can see the inferior vena cava in the background. If you look up, you can see that the hepatic vein joins the inferior vena cava. The left hepatic vein, middle hepatic vein, and right hepatic vein can be observed. If these can be observed, the right lobe of the liver is observed from below the costal arch while moving the probe. What you can see here is a gallbladder. Observe the neck, body, and fundus. Once the gallbladder is observed, the next step is to observe the bile ducts in the hepatic hilum. Rotate it clockwise about 90 degrees and scan vertically, and you can see the portal of the liver. The common bile duct, main portal vein, and inferior vena cava can be observed here. Follow the common bile duct towards the duodenum as much as possible. After that, let's observe the right lobe of the liver from below the costal arch. The right kidney can also be observed here. After completing the subcostal observation, proceed to the right intercostal observation. Observe the right lobe of the liver from the intercostal space. From the upper intercostal space, look up and down the probe and observe while moving from the ventral side to the dorsal side. After watching, lower the intercostals one by one in order and observe in the same way. Here you can see the right branch of the portal vein, right anterior branch, right posterior branch. You can see the gallbladder here. Observe the gallbladder through the intercostal space. After observing the right anterior segment of the liver, observe the posterior segment of the right liver lobe as you move the probe. This is the posterior segmental branch of the portal vein. After observing the right lobe of the liver from the intercostal space, the next step is to observe the right kidney. Let's observe the whole while being aware of the short axis and long axis. In this view, you can also check the presence or absence of liver-renal contrast and the presence or absence of ascites in Morrison's cavity. Finally, the abdominal aorta is viewed by moving the probe from the epigastrium to the patient's foot side. Observe while checking for the presence or absence of an abdominal aortic aneurysm. Move further to the foot side and observe up to the Douglas fossa.